Good morning, I'm Lauren Heiser. Let's go live to our crew at the Capitol.
Has certainly risen since, so too have the actions we've taken to slow the spread. Primarily among them is the stay-at-home order that I issued last week. Right now, working together to fight this virus actually means staying largely separate. Staying at home and even taking one Montanan out of the chain of transmission can be a life-saving act. For your neighbors, for your grandparents, for your friends, for our healthcare providers, our first responders, and our law enforcement. While our younger Montanans are considered to be at a lower risk, certainly, it's critical for them to continue to stay home to protect everyone. Like if we look at Gallatin County, 72 of the 93 positive cases are actually people under 60 years old. And how we protect everyone is do everything we can to prevent community spread. Certainly, that's protective of all of us, but it's also most protective then of those most vulnerable, including Montanans over age 65, or people who live in a nursing home or long-term care facility, those who have chronic lung diseases or moderate to severe asthma, or have serious heart conditions or compromised immune systems. We also know of those that have tested positive. Approximately 10% of those positive tests for COVID-19 in Montana work in a healthcare setting. So staying at home also means keeping our heroes on the front line as healthy as possible. In addition to staying at home, always making sure to wash your hands. And while these basic things may seem somewhat mundane, they're really absolutely critical in preventing the spread of this virus. Life as we know it in Montana certainly isn't the same as it was just a month ago. And these are unprecedented times that require us to make important and significant sacrifices. I recognize that the stay-at-home order certainly presents new challenges to our uniquely independent Montana way of life. But we've also always had an entrepreneurial spirit, and that continues to thrive even in these times. We've seen manufacturing businesses and teachers with 3D printers making masks and distilleries making hand sanitizers. Montanans are connecting with each other and with friends across the country over video and social media, hosting virtual game nights or taproom trivia and checking in frequently with loved ones. We've even gotten creative how you can measure 6 feet. You can go to a grocery store and see that it's 2 shopping carts, or even by putting 6 growlers on their sides. We're making sure that our craft brewing industry can still actually stay open and at times succeed by making use of curbside delivery. We're supporting our local restaurants with takeout and encourage everyone to do that, just as we did it for a birthday celebration last weekend. And we're getting that breath of fresh air that's much needed at times. Encourage all Montanans to responsibly enjoy our public lands. It means following those social distancing requirements by keeping at least 6 feet apart from those outside your household while hiking, biking, running, or walking. Avoid those crowded trailheads and recreate near the communities in which you live. We are certainly fortunate to live in a state with abundance of spectacular, unspoiled nature right outside of our back doors. We're also lucky to live in a place where our sense of community is strong. And I have no doubt that it's stronger than ever before, because although we can't actually join arms during this challenge, we recognize that the sacrifices made apart right now will ensure that our state remains together in the future. I can't stress enough that every step that Montanans take now and in the following weeks will make all the difference in managing through this health crisis. And I should note, I also say in the following weeks that note that the directives, the vast majority of the directives that we've put in place are set to expire next Friday, April 10th. While we haven't done it yet, I do anticipate that we'll be extending those orders, and we'll make that clear early next week. And that's in consultation with public health and others, of saying that as we're still in the middle of this, that just want to give the heads up that it will not be expiring next Friday. In addition, in addition to all the steps that we all can take as individuals to slow the spread, so too is every step that we can take to look out for our neighbors, who will also help us manage through this. In addition to actions this week to suspend evictions, foreclosures, and the cancellation of utility services, including water, heating, and internet service, we also issued a directive with additional guidance on child care facilities. Like many Montana families, our state's essential workers are pulling double duty, working and caring for children at the same time. It's important that we make sure that child care is still available, especially for those essential workers such as our first responders, our healthcare providers, our grocery store clerks. And just as important, we need to make sure that we're keeping children and workers at our child care facilities safe. The directive also requires compliance with several safety requirements, including limiting group sizes of children in classroom spaces. As we continue to do everything possible to protect Montanans from the spread of the virus, making sure that children and families in our state don't go hungry is a crucial priority. No Montanan should have to worry about putting food on the table for themselves and their families, especially during a global pandemic. I'd like to share several steps that we're taking to ensure food security for those Montana families in need during the state of emergency. These steps will be implemented in the coming days and weeks. We'll be doubling our supply of food commodities from the federal government that will be provided at no cost to people in need of short-term hunger relief through food providers like emergency food pantries and food banks, our tribal partners and senior centers. We'll also be waiving the SNAP one-on-one interview requirements and automatically renewing SNAP benefits for 12 months for any Montanan whose benefits are set to expire during the emergencies. Families do not have to reapply during the emergency. That change is expected to help more than 100,000 Montanans. Additionally, we requested from the U.S. Department of Agriculture additional benefits for families eligible for SNAP in April and May. So more than 52,000 Montana households are expected to receive the maximum available food assistance. And finally, the state will be making it easier for new mothers to access the Women's, Infant, and Children program by providing services over the phone and allowing appropriate substitutes for certain foods if availability is somehow limited. For example, if a store sells out of 2% milk, the waiver would allow whole or skim milk to qualify as a WIC permitted substitute. Montana families are already doing everything they can to make ends meet, but hardworking Montana families have been forced to take on an even greater challenge during the COVID-19 public health emergency. These are the best steps forward to ensure food security for thousands of families during these challenging times. So I appreciate you all tuning in or calling in today. I'd like to spend the rest of the time by answering any questions you may have. If you would like to ask a question, you can press 5*. You'll be notified that your hand is raised. When we unmute your phone, you'll be notified that you've been called on to ask your question. And if you raise your hand, if you've already pressed 5*, but your question's been answered, you can lower it by also pressing 5*.
First phone question.
First phone question.
Hi everyone, this is Marisa from NBC Montana. I'm wondering if you're thinking about pushing back the primary on June 2nd.
So the question was, are we thinking about pushing back the primary on June 2nd? And the answer is no. The issued a directive about a week ago that made it so that counties could choose to have a mail ballot election for everyone in the respective counties if they so chose. I believe every county has chosen to do so, but that doesn't mean that necessarily one has to vote just by mail, meaning that there's still opportunities for ballot drop-offs and some satellite voting in some of our counties. So on the front end of making sure that people have access to the ballot to vote, actually, I think that we've worked with county clerks all across the state, and that access will be there. Then the next thing that we'll have to address is to ensure that the opportunities are there to, once all the ballots are in, to count in an orderly and safe fashion, but we still have a little bit of time before that needs to be directly addressed. I know that our county clerks, and one of the reasons why we put out the directive, I think it was early last week, was because there are certain timelines that have to be met, and that's everything from ordering the ballots and things like that. So that's all now in the process. I think the Secretary of State's office has all of those counties' mail ballot plans and has like 5 days to approve them.
Another phone question.
Another phone question.
Good morning, Governor. I'm curious, Columbia Falls had an interesting situation where they had some students building a cabin for Glacier National Park. And our superintendent suggested that maybe, you could have 5, 6 students working on it at a time. Is that something that could be done?
First, I wasn't aware of that, but so construction is under the stay-at-home order an essential service as education services, so that to the extent that they're actually practicing both what's under the directive and the social distancing, as we ask the same of construction, that there's nothing in the directive that we put out last Friday that would preclude that.
Another phone question.
Another phone question.
Hey, this is Holly Michaels. How you doing?
I'm good. I'm okay. Holly, how are you?
It's going. I have a question about testing. I'm wondering if you're getting reports about how many tests are coming out of each county that are sent to the state lab, and then what sort of measures your office has in place to sort of, understanding that we have a limited supply of testing, but to make sure that what we have is being deployed sufficiently around the state.
Well, a couple of things. One of which is the vast majority of the tests are actually processed at the state lab. So if you are in a certain county, the issue isn't necessarily having testing kits there. It's making sure that you have the swabs to perform the tests. And we are...
I mean,
Go ahead.
sort of wondering, from the county, did you have an idea like how many Gallatin County is sent to the state lab, that process there?
We do not have by county, here's how many tests have been submitted.
So what sort of are the measures then that, whether it's your office or the health department, to make sure that sufficient testing, given the limited size we have, that sufficient testing is going on across the state?
Well, twofold. First of all, that look, we're working every day on supply chains, but there is we have, as an example, the state lab right now, an additional 1,500 testing capacity for another 1,500. That between a week ago, where we could only get a maximum of 600 tests per day, we've actually been able to increase that along the way. And we're continuing to work on getting the swabs to make sure that it can get out all across. And the guidance is the same for every single county, that if you're symptomatic and have either had contact with somebody that's COVID-19 or traveled somewhere out of Montana, that we are strongly encouraging you to get tested. So I don't care if you live in Gallatin County or Garfield, if that occurs, because it's also part of ensuring that we can do what we can to try to make sure from an epidemiological perspective, to make sure that anybody that could be actually positive at this point is being tested. So it's not one, the number of tests doesn't necessarily inform the epidemiology, because we're still at a point where we're asking anyone meeting those criteria to go to a healthcare provider and seek a test.
Phone question.
One more phone question, then, Jonathan. Yeah, phone question.
Good morning, Governor. Mike Hammer, KPAX-TV Radio in Kalispell.
Hi, Mike.
Where are we at as far as asking the general public to be wearing masks when they need to leave their home?
Haven't made any, go ahead, Mike. Yeah, no, there has been some discussion of that, as we've seen nationally at the CDC level, and we're monitoring that right now, but haven't made any determinations of directives. John.
Governor, we're starting to hear questions from folks about recoveries from COVID. Do we have an updated number on how many people have recovered so far? And is there any thought of whether those numbers might be released on a more regular basis going forward?
Yeah, I think it was last week at the press conference that we said that there were 32. And to the extent that I don't have this week's numbers, to the extent that we can figure out good ways to incorporate that, we'll try to do so. It's a little bit of a challenge in as much as just, and all of this works from both on the state side and the local public health labs, our local public health departments, and making sure that we can aggregate that information in a timely manner is not without some challenges, but we'll do what we can along the way. To the greater point is that also that there are people recovering and people going back, among their daily lives, and even during the times of challenge, that we have to recognize those moments of optimism. Yes, sir.
Jeremy Schnell, ABC Fox. I was wondering, you said that the expectation is to extend the directives at some point early next week. Do you expect those to be in concert with how the federal government is dealing with everything right now?
Well, I think what I intend to do is that I've been trying to keep all the state directives in a 2-week period. So, meaning that they expire on April 10th, so my anticipation would be to extend that to April 24th. And recognize when I had the shelter at home, put in the stay-at-home order last week, that the federal government, there was some discussion even then saying, well, we'll all be open by Easter. So what I want to be doing is talking to the public health folks in our state, in our community. I don't want to, some states, I think Virginia has come out and said all closures are going to be through the first or second week of June. I think everybody else in Montana would love to get back to a sense of normalcy as soon as possible. I'd said to someone, I think like most Montanans, I'm over this. I wish the virus was, and the virus isn't over this. So we'll continue to do 2-week chunks, and in consultation with our folks in Montana and federal officers and officials as well.
Phone question.
Phone question.
Eric Dietrich, Montana Free Press again. Another couple questions about testing. First, it sounds like there are quite a few tests at the state lab right now, but I'm wondering if testing availability is constraining testing practice at all right now. And then also wondering if the state had more testing capacity, if you'd be doing anything differently there.
So is testing, one more time, Eric, just to make sure I don't mess it up for you.
Oh, sure. Sure. So first thing, the number of COVID testing conducted constrained all by supply right now. I'd like to know what I want to be sure on that.
Yes. So the answer is no. That that our testing capability isn't constrained by supply right now. As an example, I think yesterday, the state lab ran 570 tests. And that doesn't count any tests that might have come from some of our hospitals and sent to out-of-state labs. So to date, the answer is no. We haven't been constrained by lack of testing supplies. But it is one where, last week the challenge was making sure that we had sufficient testing kits. This week, the challenge is to making sure that we have a consistent supply of the reagents and those things that you actually process the testing kits. In both instances, we haven't hit a point where the lab has to reduce what it's doing because that supply is gone, but it's not without daily and weekly supply chain challenges. Earlier today, I was on the phone with members of Health and Human Services in Washington, D.C., the CDC, and one of the private supply companies saying that, because there was some concern that one of our supplies chains for reagents would be cut off, so saying that we can't have that occur in Montana. And then your second question was, would you change anything if you had additional testing capability?
That's it, yeah. There's like other ways of monitoring the disease you might be looking at if that wasn't something you had to worry about.
Well, I think that it's one, and that's part of the overall national conversation that, in some respects, would love to get anybody with even a fever tested, just because it would make things that much easier. But that's not happening anywhere in the country. I'd also note that we'll probably get I'm anticipating to get 15 of the new Abbott machines. I don't have a date for delivery. Those can't be used at our state labs, but they're sort of the point of care, 15 minutes, so we'll get those out to both some of the hospitals and hotspots. But so far, the supply constraints haven't reduced our ability to conduct tests anywhere in Montana. And who's getting tested in Montana is consistent with what the CDC guidelines are for testing.
Another phone question.
Another phone question.
Governor Bullock, Josh Margolis, New Media Broadcast from Now. Can you hear me?
I can, Josh.
So my question is, at what point, if these closures keep extending 2 weeks, does it not become feasible to reopen schools? And will you be considering having in-class schooling done for the rest of the semester?
Yeah, Josh, and I think it's something that we have to assess in 2-week blocks. I think that both, on the one hand, we have teachers and administrators and stuff that are really providing, good remote learning opportunities, but I have no doubt that both those teachers and those students would love to be back in the classroom. So I think it's premature, certainly, to say that for the rest of our school years that we're going to stick and just do remote learning, and we'll continue to monitor it sort of a 2-week by 2-week period.
Another phone question.
Please.
Hi, this is Nikki Willett from Yellowstone Public Radio. How are you?
Okay, Nikki, how are you?
Tired.
Yeah, me too.
Yeah. I'm curious if you considered shutting down commercial air flights coming into the state, and why or why not?
I've not, so the question was, have you considered shutting down commercial air flights in the state, and why or why not? There's a piece of being one state in the chain of overall commerce and disruptions that it would not, from my perspective, make sense for any state to say no more commercial air travel into Montana. But I have taken the steps to say that anybody that's traveling to Montana for non-work purposes, that it's a directive that you shall quarantine for the first 14 days. Starting today at the vast majority of our commercial airports and our train stations. We'll have members of the National Guard who will both tell people coming off of flights that of the directive to quarantine, but we'll also be temperature checking. If somebody posts a higher temperature, then there'll be an immediate consultation with a doctor. It'll be a telemedicine consultation, and then we would direct the public health department. So you've already seen significant decrease in airline traffic, but those that are coming on airlines and rails to Montana, we want to make sure that they too are part of the effort to stay at home and contain the spread.
Phone question.
Phone question.
Hi, Governor. My name is Colin. Can you hear me?
I can. I missed your name, sir.
Colin Geiser from the Jail Interlake, Kalispell.
Hi, Colin.
I was wondering if you were having ongoing discussions with National Park Superintendent like Jeff Malcolm Glacier. I was wondering if you would expect those national park closures to sort of go along in lockstep with the stay-at-home directive. So I guess what kind of discussions might you be having with them? And I mean, what's their level of independence in that decision-making process?
So both for Superintendent Mao and Glacier and Superintendent Shawley in Yellowstone, there is independence on the federal side of whether or not they would open a park. I was certainly pleased and had a number of conversations with Jeff, and earlier in that week when we had Yellowstone shut down, where I had made a request of both of the parks. I had actually spoken then to the assistant secretary that's in charge of the overall national park system, requesting those closures, because also we had people coming to Montana to go to the parks where it could really impact our border communities. So I would hope that, and I'll continue to be in conversation with both of them, I would hope that as they look at when the park system would reopen, that it would be consistent with what we're doing at the state level. And I think they're both good partners and would do everything they can to make that the case.
A couple more phone questions.
Another phone question.
Governor Bullock, this is Charlie Dennison in Lewistown.
Hi, Charlie.
How you doing today?
Okay.
So, Governor, I was just wondering, there's a lot of talk of people in Fergus County and the surrounding area still going out of town, Billings, Great Falls to get goods. What advice do you have for people in rural communities our size? What's the best way they should approach this stay-at-home directive?
Yeah, I mean, the advice for rural communities and urban communities is if you can get it close to home, stay close to home. Limit your travel along the way. And certainly if someone's going from Lewistown to Billings for those essential services, there's nothing in the directive that would preclude it, but we all should do what we can to limit the community spread, and that's largely staying at home, and that's if we can get our supplies or our food and what we need to try to do it locally, because also, you know, the other, and this, I'm well aware of that, and it's not just in Montana, but this has caused significant challenges for our small, medium, and some larger businesses, and this is that much better of a time that if you're in a smaller community, to the extent you can, to buy local.
Two more questions on the phone.
Please, someone on the phone.
Yes, Governor, this is Aiden. The question I have, issue in Northeastern, as you know, TC Energy has
I'm sorry, you're in and up about every other word. So if, I don't know if you're on a Bluetooth or something, but I was missing a chunk of it.
Oh, no, Governor, I'm on Can you hear me now?
Right then I could, yeah.
Okay, so the question I have is the region that current Keystone pipeline production that's coming to the area. As you know, about 100 meters plus families have shown up in the last 2 weeks. There's a lot of anxiety from the local community surrounding that. What do you say to maybe the north of Montana, especially along the Highland where there are currently no COVID cases outside those that guarantees that this won't be this region?
Yes, so the question was, folks from TC Energy have been coming in. They've been, over the last couple of weeks, that there aren't any positive tests in the Glasgow area right now, and that there's some concern. I mean, I've certainly expressed some concern about that as well. And I know that they're working with the local health department. Even more than that, though, so pipeline and construction under the Department of Homeland Security guidance and under the directive, they are essential activities. And I've had conversations with everyone from the Premier of Alberta to several conversations with individuals at TC Energy. They work closely with the local health department, but I think that they've even taken some additional steps as well. As but an example that the directive doesn't require individuals traveling into Montana for work purposes to quarantine. They've agreed that anybody that comes into our state to work on that must quarantine for 14 days prior to allowing them to start work. They're providing essential services to workers during that quarantine. They're having enhanced isolation measures of the workforce from the community and minimizing additional workers and construction crews at the border crossings. They're maintaining a daily log for all people on the site, indicating sort of any COVID-19 symptom checks. And those are in addition to what they had talked to with Valley County. I share the concerns, and certainly, well, I understand they've worked closely with Valley County. I've further asked our chief medical officer at the state to coordinate with Valley County to evaluate the measures that they put in place, and we'll continue to do so.
Final phone question.
Final phone question.
Ending in 1870.
Ending in 1870. Someone is unmuted.
Hi, Governor. Can you hear me now?
Yes, ma'am.
I have myself muted. This is Catherine from the Chronicle. I'm following up on a test question. I guess what I'm wondering is, if the state doesn't have a breakdown of what testing looks like county by county, and we know that hospitals are also seeing kind of a lack of some supplies to collect samples, how do you know what testing looks like throughout the state that nobody's kind of hampered in being able to do testing?
Well, I think, Catherine, from the perspective of that we are literally at the state level and then working with hospital association and local providers, there's a daily survey of both what needs are and what the capacity is. So from that perspective, it's not the number of tests that drive this, it's when your local health director says, here's what we have between DES and our understanding of hospitals of N95 masks, and then as we're trying to push more out to the extent that we can get them. So I guess it's not necessarily the number of tests that's driving the supply determinations, it's the requests from local counties and communities about what supplies that they need as we're trying to marshal those at the state level. Anything else from you? Again, thank you for joining this call, and thank you for your efforts, your patience, your understanding as together as a state, we do everything that we can to both get our arms around COVID-19 and protect our friends, our neighbors, and our families. Thanks so much.
That was a press conference live from the Capitol. Governor Steve Bullock reiterated the importance of supporting local businesses, washing your hands, and social distancing. He also reaffirmed it's not just the elderly who are getting sick. In Gallatin County, he says 72 of the 93 people who have been affected and contracted the virus are under the age of 60. Our Jonathan Ambarian asked the governor if they had an update on the number of people recovering in the state. Bullock said the only number currently available was the one from last week, and that number was 32. He added they are working to find a more efficient way to communicate that more regularly to the public. The Montana Response COVID-19 tracking map shows that there are more than 240 confirmed COVID-19 cases in Montana. As of this morning, there have been 5 COVID-19 related deaths reported in Montana, as well as 24 hospitalizations. A total of 5,576 tests have been completed as of Wednesday evening. In his press conference, Bullock announced new measures to assist people utilizing SNAP benefits. Bullock also said the shelter-in-place order will likely be extended. They will announce how long it will be extended at a later date, but he did say that they are evaluating many regulations and orders on a 2-week basis. We will continue to bring you more coverage from this press conference in our noon show and our 5:30 news with Jill Valley. You can also find more information at our website, kpax.com.